Hey guys, how are you all? Welcome back to MedSteps YouTube channel. So today in this video we are discussing about very important and high yield topic, that is compartment syndrome. Why? Because this is true orthopedic emergencycal pathological condition, and it's like time sensitive, like it's like irreversible muscle and nerve damage can begin within 6 hours, and it's delayed. If you are delaying the diagnosis, it leads to permanent disability, limb loss, or even death. Why? In this compartment syndrome we have some hallmark, that is one special test. If you are doing passive stretch, that patient will feel pain, and it's this compartment syndrome pain is not relieved by any analgesics. Okay, so this is the hallmark for compartment syndrome. So what's the definition? Increased pressure in a closed space, a compartment which will result in decreased perfusion, ischemia to the muscles and nerves. That means, okay, I will explain this thing with image. For example, if you are seeing this first image, you can see here this is the lower limb. In lower limb, this patient got some open fracture. That open fracture, like when if you are seeing the X-ray, comminuted spiral fracture and some displaced tibia fragments also. If any, what's the fracture definition? If I am asking, means if any break or disruption in continuous bone is known as fracture, right? Here, because of that fracture, because of that fragments is displaced, that part will get some pressure because to bleeding, because of edema. These things can increase pressure. Because of that pressure, that surrounding compartments will get some compression. Because of that compression, that blood flow will decrease. If blood flow decreases, means that perfusion will happen, means automatic, that structures will get ischemia. Ischemia means why? Because that blood vessels contracted, that blood vessels are not providing enough blood. Because of this ischemia condition, that tissue will get necrosis. That necrosis, after necrosis, that tissue will death. So this condition we called compartment syndrome. Okay. Now, for example, if you are seeing this image, here in this image you can see this left leg, you have total redness and warmth. Okay, so this is the main sign and symptom. In inspection you can see this type of picture, and don't confuse with cellulitis and compartment syndrome. In cellulitis you can see some like fluid type bumps you can see, but in compartment syndrome only redness you can see. Okay, next, for your deep explanation, this is your leg. Okay, if you are cutting your leg like this and you are seeing from the top, you will see this type of image. This is compartment of the lower leg. In this leg you can see total, this is tibia bone and this is fibula, and you can see 4 compartments, that is anterior compartment, posterior compartment, lateral compartment, deep posterior compartment. If any bone fracture happen, means that part will get compression. Because of that compression, it's that total compartments will get that pressure. Because of that pressure, totally that parts will get ischemia. Okay, then that patient will get too much pain. Okay, next, loss of capillary exchange. I already mentioned this thing. It can cause irreversible damage to the contents of the closed space. It may lead to Walkman's ischemic contracture of leg and forearm. If you are seeing this image, because of ischemic, because of low perfusion in forearm, you can see this type of image. This is clinical picture of forearm. If you are seeing this image, you can see elbow flexion, forearm pronation and wrist flexion, and this type of contracture you can see in patients. Okay, now we are discussing about pathophysiology. After this compression, because of increasing pressure, the blood flow will decrease. Why? Because I already mentioned, because of maybe edema and hemorrhage, because of fractures and some applying some tight cast. Okay, now compartment pressure greater than capillary pressure, around like 20 to 30 mmHg. Then after muscle level ischemia for 4 hours can cause damage, but damage is reversible. In 4 hours we can reversible the damage. Okay, if 4 to 6 hours ischemic compression is there, means it can cause variable ischemic conditions. Next, after 8 hours will cause irreversible irreversible damage, and for that thing we have to do surgical emergency. That in surgical emergency we have to do fasciotomy. What's the fasciotomy means? We are removing this parts, this fascia, and we are increasing the surface area. Okay, we will remove that fascia and we will increase the surface area, because of that fascia, that part getting too much compression. Okay, next, after fasciotomy, for surgical emergency we have to do. If you are not doing, means it can cause tissue ischemia and necrosis. Next, in nerve changes, if that compression we have like in 1 hour, means that normal conduction velocity will decrease. If 1 to 4 hours, means we can regain that nerve damage. Okay, we can reversible that thing. But after 8 hours, means it's irreversible damage, totally paralysis, we can't do anything. Okay, so this is the pathophysiology of compartment syndrome. Next one, classification. How we can classify the compartmental syndrome means we have two types of classification. First one, acute compartment syndrome. Second one, chronic exertional compartment syndrome. In acute compartment syndrome, it's like medical emergency condition, typically caused by maybe some of the trauma or fractures and crush injuries, and it can lead to irreversible damage within hours. Within hours, we can, if you are treating this thing, means automatic that damage, that part we can bring back, that function we can bring back. Okay, next one, chronic exertional compartment syndrome. It's reversible and seen in mostly athletes, and it occurs during because of exercise, and it's relieved by rest. That is chronic exertional compartment syndrome. Next, what are the causes can cause the traumatic compartment syndrome means? First one, traumatic. In traumatic, we can see fractures, most fractures like tibial fracture and supracondylar humerus fracture. Next, crush injuries, reperfusion injuries like after arterial repair. Okay, in vascular injury tears. Next, burns, tight casts and bandages can cause compartment syndrome. In non-traumatic, coagulopathy like anticoagulant, hemophilia. In post-surgical also, like vascular and orthopedic surgeries can cause the compartment syndrome. And snake bites. How snake bites can cause compartment syndrome means after getting snake bite, in village people they will do tourniquet for for spreading that poison. If you are doing tourniquet, we are compressing that blood vessels and everything, we are blood vessels will get compressed and it can cause compartment syndrome. Okay, next, intensive exercise, that mostly repetitive exercise if any person is doing, means for that people can get compartment syndrome. Next one, sign and symptoms. In sign and symptoms, I already told one hallmark. In compartment syndrome we can see pain and passive stretch in early signs, and we have one mnemonic, that is 6 P's. In 6 P's, first one, pain. P means pain. That pain is also out of proportion or worst symptom in compartment syndrome. It's like that patient it's too much pain, that patient can't bear that much pain. Second one, pallor. Pallor means that I already saw one image, that is pale skin. Third one, paresthesia, that patient will get tingling sensation or numbness. Fourth one, paralysis. In late sign we can see paralysis because that functional, that means loss of function we can see. Next one, piclothermia, that limb is getting cold because of low perfusion, that patient will get that cold limb. And in treatment we can see emergent fasciotomy we have to do. Now, what's the diagnosis? How we can diagnose this compartment syndrome means we have one equipment, that is compartment pressure measurement. It's like one type of injection. We have to, with injection we can understand, we can know the pressure. absolute pressure is greater than 30 mmHg, like delta pressure equal to diastolic blood pressure minus compartment pressure less than 30 mmHg. We can check with imaging, but for ruling out other causes we have to use imaging. It's physical examination and sign and symptoms enough for diagnose the compartment syndrome. Okay. In management, initially we have to remove first that constructive dressing or cast. Because of too much tight, that patient getting compartment pain and everything, this type of sign and symptoms of compartment syndrome. And we have to use some analgesics and oxygen and fluids, and we have to elevate the limb at heart level. Okay. And fasciotomy. In fasciotomy, why we are doing fasciotomy? We are decompressing of the compartments. And for surgery, if that compartment syndrome on leg, then we have to do 2 incisions for 4 compartment fasciotomy. If in forearm, we have to do volar and dorsal, and we have to delayed closure or skin grafts needed. Okay. If we are delaying the closure, then sometimes we have to do skin grafting or some plastic, we have to approach the plastic surgeon. Next, in post operative care, we have to check wound frequently, and we have to control the pain, and we have to monitor the infections, any inflammation is there or not. Then after, we have to delay the skin closure like often 2 to 5 days, and we have to do debridement of, if any necrotic tissue is there, means we have to do debridement, means we are removing that excision of the inflammation, that necrotic tissue. Okay. So now, complications of compartment syndrome, I divide into 2 types, early and late. In early complication, we can see myonecrosis and infection and sepsis. In late compartment syndrome complications is Walkman's ischemic contracture, especially mostly I saw in forearm, and nerve damage and chronic pain, and some like renal failure due to rhabdomyolysis. Okay. So this is the compartment syndrome. If you have any doubts, you can ask me in comment section, and actually this is orthopedic very high yield topic, that's why I discuss this thing with you. So we discussed about compartment syndrome, definition and classification, pathophysiology, causes, sign and symptoms, diagnosis, and how to management and complications, and post operative care. Okay. So if you like this video, like, share and subscribe, and we will meet in our next video.